Hi, I'm Dr. Brant Pedersen, and today I'd like to talk to you about tennis elbow and golfer's elbow and why we would wear a brace. What is the idea of wearing a brace? Is it something that I have to wear forever? What is the idea and how is it going to make the pain less? And is it actually going to help me heal or just cover over a symptom? Also, which brace do you like the best? Because there's a lot of different things on the market. I'm going to give you my recommendations for what I think works best from what we see clinically with our patients and our athletes. So first off, tennis elbow is pain at the lateral portion of the elbow here, which would be on the thumb side, kind of right here. We call that the lateral epicondyle. You don't have to play tennis to get tennis elbow. Golfer's elbow would be on the opposite side. It's your medial epicondyle, and that's where all of the flexor muscles that flex our hand and our wrist, they all come off this medial aspect here. All of the extensor muscles, all of the ones that extend my fingers and extend my wrist, they all come off of your lateral epicondyle. And so what we're trying to do with a tennis or golfer's elbow strap, and it's the same strap regardless of what you have, actually it'll help with both of them at the same time, is reduce the load that is placed on the tendon where those muscles go and attach into the bone. Those tendons have started to change, are inflamed. And so what we're trying to do with the strap is distribute the load that is going through the muscles into the tendon, distribute that load into the surrounding tissues. The one that we really like and have good success with is called the Bandit Brace. I'll put a link down below into Amazon where you can get it. But the Bandit Brace, the reason that I like it, and there's a lot of different ones, is it's a reasonably priced one. There's some really fancy kind of robotic looking ones. But what I like about this is that the area that we use to compress the tissues here and distribute the load, it's padded. It's also backed up by plastics. Over time, it doesn't wear out. But probably most importantly, when we put this on, it doesn't compress what are called the neurovascular bundle. So running down your arm here, then down your forearm like this into your wrist, you can see here, is what's called your neurovascular bundle. It's where the nerves, the arteries, and the veins all run in your arm. And we don't want to compress those structures. A tennis elbow strap or a golfer's elbow strap that wraps all the way around the elbow then takes and compresses those. And we want to leave the blood flow and the nerve flow down into the arm and hand unobstructed. So the Bandit Brace does a great job of that. The most important thing is that when we go to tighten it down, that we make a fist, which actually kind of pops those muscles up. When we're putting it on, put it on snug with that fist, and then relax. So that during your daily life activities, it's not bothering. But when you pick up something that would cause pain into your lateral or medial epicondyle, that it doesn't cause pain. Lastly, you don't put a tennis or golfer's elbow strap right over the area of pain. Again, we're putting it over the muscle wad here. We call it the extensor or flexor wad of muscle, putting it over the middle of that muscle belly so that it distributes the load, not into the tendon, but takes some of that loading off and puts it into the surrounding tissue. When putting on the Bandit Brace, you want to bring it up to the area of your arm. You want to feel where the lateral epicondyle is, where you'll have that tenderness. You want to place it a little bit closer down towards your wrist. In this demo, we're probably placing it a little too high. You want to get it snug with your fist while you're making a fist. And that way, when you're going through your normal actions, it won't be tight on there, just when you go to grab something. And then you want to make sure that the Velcro portion, not the white portion, is not pressing in on that neurovascular bundle where your arteries, nerves, and veins run. It should be comfortable as you move around, and it should help to reduce your pain as you're grabbing stuff if you're doing it right. So is this going to heal stuff? Your body is going to heal stuff, but this is going to make it so that when you pick up a pot as you're cooking, when we go out and play tennis or golf, when we are working in the backyard, whatever it might be, picking up boxes at Costco and putting them in the car. If we are doing that and we're feeling pain, that's taking us farther away from becoming pain-free. You're actually irritating those inflamed tissues and making them worse. So that's where something like a Bandit Brace, a tennis elbow strap, a golfer's elbow strap helps you in the short term to heal. Do we have to wear it forever? No. once you get the tissues healed. And we talk about some other videos, I'll link them below, but other videos on doing the Tyler twist or the reverse Tyler twist. Those are the ways to get lasting eccentric control, and you'll understand it if you watch the videos, eccentric control of those muscles so that you don't keep propagating and getting more tendinopathy.